Hey, another day of sort of lockdown. I know here in Texas and 22 states they're starting to open things up, so that's good. I don't know what's going on where you're at, but regardless, we enjoy having you here online. So jump on in. Chat is open. If you're watching us live, if you're watching us in the replay, always say you're welcome to join us in the noon hour, noon Central Time. That's Texas time because, yes, the world does revolve around Texas. At least that's the way we feel here in Texas. Just ask any of us, we'll tell you. No, I'm kidding a little bit. But I have a guest with me today from Boston, which has been pretty hard hit by the coronavirus. And he is a doctor of all sorts of things, and we'll get into some of that. So I think you'll get some pretty good information in here. Dr. Finny Kuruvilla is with me right now, live from Boston. How are you doing, doctor?
Great. It's good to be with you, Randy.
Well, let's get the quick update from the ground from someone who is seeing things going on. What's going on in Boston right now?
Yeah, so like a lot of parts of America right now, things are starting to flatten and we're starting to see hopefully the light at the end of the tunnel. Nationally, we're at around 45,000 people have died from COVID-19, sadly, but it looks like that's beginning to plateau and maybe even decline a bit. So that's encouraging. The other big developments are there's a lot of very exciting therapeutics that are coming out. There are a number of clinical trials that are reading out even in the coming days here, which we're following with great eagerness. I'm a doctor, but I also work in the biotech industry as an investor, board member, and we follow that space very carefully. And if we get some more good news on the therapeutics, that will accelerate our coming out of the lockdowns and shelter in place.
All right, so I want to talk about some of that, but just to explain a little bit of your background. I'm not going to try to do it for you. So explain the biotech and your medical background real quick. Just give people an idea.
Sure, yeah. So I did my undergraduate studies in chemistry. I was born and raised in LA, in Southern California. Came to Boston to go to med school. I did my MD, my medical doctorate, and my PhD in chemistry and chemical biology. After that, I was a resident, chief resident, and fellow at a hospital here in the Boston area. And I saw patients for approximately 5 years. Really enjoyed that. And then I made the move from that into the realm of biotech. And so biotechnology is how you combine the world of medicine with science and translate all of these great insights that the scientists are coming up with into practical new medicines for treating patients of all kinds of diseases.
All right, so right now you are working on producing some. Uh, what are they considered? Are they vaccines? Are they treatments? What exactly?
Well, yeah, it's the companies that we're investing in and others that we're not. But we're not personally investing in vaccine companies right now. Some of our companies are focused more on some of the small molecule therapeutics or the antibody approaches. So the small molecules are basically pills that you take. They can be injected IV, and then the antibodies are where you get some of someone else's immune system that's purified, of course, that has the antibodies that are designed to attack the virus, and you can inject those into a person and either prevent them from getting the infection or reduce symptoms if they already have it. So we have a number of companies that are working in both of those spaces.
Okay, so you're in a much better position, I think, to assess some of what's going on than the average person, the rest of us out here. So give us your take on this whole COVID-19 thing.
Yeah, it's a good question. So the first thing I think we should say, and especially from a Christian worldview that I speak from, is that the number one word, if I had to say, is just humility. That we're all learning a lot. There's new data coming out all the time. It's hard to say that anyone really has any corner on the market. There's certainly people who know more than others, but this is something where even the top experts are learning a lot day by day. And because of that posture of humility that all of us hopefully should be having, I think it's important to be gracious and kind to those who are around us, and in particular to our authorities. You know, one of the things that I feel a little bit of sadness about is sometimes it feels like there's a lot of complaining and protesting when we get to be, kind of armchair critics, and we don't have to be the ones making these decisions that affect thousands and thousands of people.
Hmm.
And one of the principles that we see in the Bible in Romans 14, Romans 13, and other places is this notion of submitting to authorities and recognizing that authorities have a position over us that's God ordained, and we ought to just go along with that gladly and not be begrudging citizens that are questioning their motives and questioning what they're about. I feel really bad for people like Tony Fauci and Donald Trump and others that are making these monumental decisions that, again, for us, it's easy to sit back and criticize. But if we were in their shoes, it'd be a much harder case. So that's the first thing I would say is we got to have humility in this as all this data comes in, as we learn more about the virus, as we learn more about the trajectories of who's getting it, who doesn't have it, how many people have it. So submitting in a glad sense to our biblically appointed leaders should be the first thing. Second thing is that we don't know exactly all of the numbers. And I think everyone now is in this point of almost a radical skepticism, which I think can be unhealthy. We know more than some of the radical skeptics think, but we don't know as much as we'd like to. I think that's a fair way of saying it. We should be, I would say from, again, a Christian perspective, taking on this current position that most of us are in Boston. We definitely have pretty strong shelter-in-place guidelines that we've been given, as well as from President Trump. I would say that we should be in a position to say, you know what, we may not like it, we may not understand it, but this quarantine now is like, it's actually a pretty reasonable response. When you look in the Bible, in the book of Leviticus, there's a very strong theme of if somebody has a disease, the priest would inspect them, and they'd have to go out of the camp and hang out there for a couple weeks just for caution's sake, because God in his wisdom knew that it would be better to keep them apart than have them mixing with everyone else when you've got a couple million people in a fairly close area there. And so quarantine, going back thousands of years to the time of Moses, has always been a biblical way of thinking about it. And sometimes, again, I worry that people say these things like, oh, I'm going to just have faith and I'm just going to go out and do whatever I want and be in close proximity to others. Well, really, that's kind of an unbelieving response. That's actually, from a biblical perspective, that's not really how things have functioned. And one of the things that I'm very proud of from the perspective of church history is that there's lots of great examples of responsible Christians who have actually shut down illnesses like the Black Plague, which killed a huge number of people in Europe in the Middle Ages, because they said, you know what, let's just take these kinds of precautionary steps that we see in the book of Leviticus that we don't totally understand. We don't understand all of certainly back then they didn't understand all of the nuances of the biology here, but it's a reasonable response while we're learning, while we're now, in this case, deploying all of our medical armamentarium to tackle this disease. And so those would be, I think, that the main two things I would say is let's have humility as we're receiving the data. Let's be gracious with our authorities here and not be complainers, and to understand that it's not actually a crazy response. It's a biblical response that we should be glad for. I think it's most likely that we've saved tens of thousands of lives in America, and certainly beyond that as a result of all the measures that we've taken. Again, the numbers are up in the air. We don't totally know, but this is encouraging overall, and we should be glad to participate in this as a way of loving our neighbors.
I actually agree with you. This is Dr. Finny Kuruvilla, and he addresses some of these things in his recent blog called Coronavirus Assessment. We need to truly drop the hammer, and that's what you're talking about. It's taking things seriously and putting our neighbor number one. I do want to throw out some of the sort of counter arguments or counterpoints to what you're saying, because I just think we need to deal with them. I'm not trying to argue with you.
Sure.
If I want to argue with you, I'll let you know. But so when we talk about quarantine, which I believe literally means 40 days, is that right?
Yeah.
Which is interesting because we're getting close to that.
We are getting close.
But that was, well, one, I love that God was way ahead of science on this.
That's
one.
Right.
Brilliant. And people didn't understand it, but if they would just obey, then God knew the science behind it. And so I think a lot of times when we don't understand things, if we'll just obey God and trust Him, it's because He knows better than we do. Nowadays, we think we know better than God. That's another point. But here's my question. The quarantine was, as you pointed out, to remove the sick person from the population, not to incarcerate the population. So the quarantine was for the sick, not the well. Is that a valid point?
Yeah, and by the way, I love these discussions, and I think we should be having these conversations and challenging each other in this. Of course, the big question is we didn't know who was sick and who wasn't, right? So that's the
Right.
problem with
Yeah.
COVID-19 is it has this incubation period of, let's call it 3 to 14 days. And because we don't know, because we couldn't see the skin lesions like they could in, say, the book of Leviticus, we didn't know. And so for caution's sake, the authorities that are out there said, let's presumptively treat people as if they might have it, just for the sake of caution, and thus mitigate its spread. And I mean, consistently, what we've seen is that when people have followed this in other countries, there's really good statistical analyses that are coming out now. It does seem to bend the curve. It does seem like these are measures that work, and we're seeing it now, right? I mean, this could have gone to many uh, more Americans than it has, and it hasn't. And so we should be thankful for that. So yeah, I take the point, but in this case, it's unfortunately invisible.
Yeah. No, yeah, you're right. That's a good point. The second question I have is on authority. And this is a long-standing debate. I don't think we're going to settle it right now. But the idea that all leaders are placed in authority by God
Hmm.
versus the idea that only godly leaders actually have true authority. Um, and we're getting some of this, and you know the fact that President Trump has left it a lot. You know, they put up guidelines, obviously,
Right.
but they've left a lot of it up to local areas. You know, because well, 52% of the deaths are in New York City. You know,
Hmm.
and so how does that affect Wyoming, or as Dennis Prager pointed out today, Montana? You know, um, in places like Michigan, it does seem odd that you can go out in a rowboat by yourself, but you can't go out in a motorboat by yourself. It seems to go
Right.
beyond the idea of quarantine. Or you can't
Right.
buy seeds to plant a garden, but you can buy lottery tickets. So there are some strange things going on. What do you think about just the wide range of response? You know, in Texas
Yeah.
here, Governor Abbott has been fairly lenient, so it's just different wherever you go. What's your take on that?
There's no question that there are a number of these regulations that have been put out that are irrational, right? You just pointed out a couple of them that don't make a lot of sense. And unfortunately, when we're dealing with these rapid responses that aren't necessarily that well thought out, and again, I'm not trying to fault people because I understand that things are happening very quickly and you just don't have the time necessarily to parse out, does this make sense or not? But a lot of the things don't seem rational. And it's easy for us, again, the armchair critics who don't have to make these decisions, who don't have to incur the wrath of all the different constituents that governors and presidents have to do to be critical there. So I'm not disputing that. But so this is what's fascinating. So that passage in Romans 13 that I just alluded to, where we're called to obey these governing authority. It was written by Paul, the Apostle Paul, approximately the year AD 57, and the emperor at the time when he wrote that letter was Nero, right? This is Emperor Nero, who was
Hmm.
probably one of the worst, if not the worst, persecutors of the church in the history of the Roman Empire. I mean, this was a pretty bad guy, right? This was a guy
Yep.
who was famous for being fickle, for killing Christians by the hundreds, and later on would be the one who killed the Apostle Paul himself. And so, in this irony of ironies, Paul doesn't even know it at the time. He's writing to submit to these authorities. He's writing under Nero at the time to Rome, where Nero happens to be. And that very Nero is one day going to have Paul's head removed from his body. And so, what I think it says is that even these ungodly leaders have a measure. Now, doesn't mean they have God's blessing in totality, of course not, but they have, in some sense, been delegated this authority by God for a reason. And in this case here, where, okay, when we're talking about your example there of lottery tickets versus garden seats, it doesn't make a lot of sense. I agree. But at the same time, they're trying to do things for our good here. They're all trying to save as many lives as possible. This is not some prohibition against Christianity or some wicked law that is obviously malevolent. Even though we may not agree with it in all of the details, and maybe we do it differently with the benefit of reflection, I still think we should go along with these laws just because we are called to honor the emperor, as again Paul says in his letters.
Um, how do you balance that with I ought to obey God rather than men?
Right, yeah. And so when there is a direct contradiction between a scriptural command and a command that the government gives, then we ought to say, you know what, let's choose God rather than man. So that's that famous line, of course, from the book of Acts. And there are times that this happens, and there are times where governments make laws that are directly opposed to what God has ordained for us in the New Testament, and there we have to choose. But in this case, there's no such dichotomy that we're
Yeah.
being put up against.
Yeah, yeah, true. I don't think that applies to, me not getting to go to Taco Tuesday.
Right,
Right,
right.
which is a big thing down here in Texas. A question from, and I'm going to go ahead and answer it because I know you'll back me up. Someone says, if what we're doing is working, how come the United States has the most cases? Well, it's simply a matter of population. In fact, if you add up the countries in Europe that have been affected by this to equate the population of the United States, which I've seen different numbers. I've heard 320 million. I've heard 380 million. So I'm going to just give it that range. But if you add, as far as population in the U.S., if you add up the European countries, we are far, far lower in the infection rate, although that's very fluid, but definitely in the mortality rate.
Correct.
So what we're doing does seem to be working. Does it not?
Absolutely. And yeah, so the number here that a lot of people will use is deaths per million people. And the US has actually done way better than Spain, than Italy, than a number of
UK.
very developed countries in the West. And so, yeah, has the response here been perfect? Of course not. There's a lot of things that, again, benefit of hindsight, we'd say, oh, we should have done this or that. But on the whole, it's worked, and we've got we're certainly better off population adjusted than a lot of other countries.
Yeah. What do you think about a second wave? I mean,
Yeah, so
should we
it seems,
expect that? Or, you know,
yeah, I'm a little bit more optimistic that some of these therapeutics are going to work out. So
okay.
right now there's over 70 vaccines that are in clinical trials, and those aren't going to come out till 2021. But still, that's exciting that we have that many companies willing to put up capital for this effort. And then we have hundreds of other companies that are testing specific molecules for, as I said, oral pills or intravenous injections that will treat the disease. And some of them we have early looks at that are very promising. We're waiting for randomized data. So randomized studies are where you take a group of people and a computer kind of flips the coin, proverbially internally, and it puts them in group A or group B, and it can accurately track what is going on with these two groups of patients, and they don't even know if they're getting the active medicine or the control.
Yeah.
Right? It's called a blinded study.
Right.
So those are the gold standard, and because you want to take away all the psychological biases that people have, and those data are going to be coming out. Actually, some are going to start next week, and there's going to be a steady cadence of those readouts into the summer. And so I'm personally more optimistic that we're going to get good therapeutics. And even if we do get a new wave of infections, so long as it doesn't turn into a new wave of deaths, I'm okay with that, right? I mean, we can, if it's just people having to stay at home for a couple of weeks and have the fevers and the chills, so long as we can nip this virus
Yeah.
in the bud before it gets to people being in ICUs.
Yeah. So what about the treatments? Hydroxychloroquine with zinc and
Yeah.
possibly the Z-Pak for the infection, and then the remdesivir or something like that. I'm so
Yeah,
bad.
remdesivir. Yeah.
Remdesivir.
Yeah, so yeah, both promising therapies, but the real answer here is nobody knows, right? And it's so important for us to be comfortable living in uncertainty right now. One of the things that it relates to what I was saying before about this posture of humility is that, a lot of times people feel like if you're smart, you got to have the answer. Well, sometimes being smart means you don't have the answer, and means you're wise enough to say, we don't yet know. Let's let the data mature and come out, and that's going to happen in the next few weeks with the hydroxychloroquine studies and the remdesivir studies. There's a lot of anecdotes here and there, both directions. We don't know. It's promising. It's definitely something that we should all be excited about, but not something to bank on or to say we know what's going to happen. Thankfully, as I said, there's a lot of great data coming out, and I'm really excited about the promising developments and data packages that will soon be with us.
Last medical question, and then I'm going to talk about some of the role of the church and Christians throughout all
Yeah.
this. But with the testing, I've seen that tests will test you negative even when you're positive, like 30% of the time. So we're hearing a lot about, oh, we need more testing, we need more testing. How good is the testing?
That's Randy. This is such an important question. And right now, the FDA, for good reason, and again, I'm sympathetic here, they've said we're not going to have to go through the approval process in order for you to start marketing these tests. Now, we're not used to this because normally there's really good quality control that happens before anything ever hits anything like medical practice here. This is the first time in our lifetimes that we've ever had anything like this where the FDA said, hey, it's the Wild West. You got a test, go out there, and sometime later we'll figure out if it's legit or not. There's all of these testing companies. Many of them are pretty shady, and frankly, some of them are doing second-rate work that we know now as the data are coming out. They're just not good tests. These are not easy to design. It takes a lot of expertise and reliability in building them out. And so we got to be really, really cautious in interpreting some of these. I personally would look for some of the more reputable test makers that are going to come out in the next few weeks, companies like Roche, Thermo Fisher, others that are not these kind of garage-made shops that are out there, unfortunately. A lot of these places, these test kits are coming from China, and the quality from those is also just very shoddy, very poor. So we got to be really careful and take everything here with a grain of salt.
I agree with you on that. All right, shift gears just a little bit. Again, we're talking to Dr. Finny Kuruvilla, and this is a blog that he did. The blog is on an interesting site. It's sattlercollege.org, S-A-T-T-L-E-R, college.org. And this is a college that you founded. Tell me a little bit about that and why you did that, because that's not an easy thing to do.
No, in Massachusetts, where we're at, we're the second new college in 40 years. Colleges don't come around very often. It's a bit of an old boys club, which is one of the reasons why the costs have gotten so out of control in higher ed, is there's very little competition. And so in most areas of our world, when things get really expensive, you get more people to come in and compete. But when you basically have a monopoly, you don't have those same cost competitions that normally drive the price down. So the reasons that I started it were threefold, and I sometimes call it the 3 Cs. So it's the core curriculum, it's Christian character, and it's cost. So in terms of the core curriculum, when you look at how colleges used to be many years ago, like when it was Harvard and Yale and some of those places, everyone had to do Greek, everyone had to do Hebrew, everyone had to do Latin just to graduate. This was like expected for what it was to be a literate member of society, church history, theology, all those great subjects. And today, we're the only college in America that requires people to do Hebrew and Greek, even if you're doing biology, even if you're doing computer science. A core curriculum is a statement of the values of the nation or the communities. And in general, we've become less biblically literate, and we tend to value less the ability to read primary sources in the original language, which was once prized. Now we're just generally lazier. So we've restored a core much more in the classical Christian tradition, which, like I said, puts us in this case, we're the only college doing that. Secondly is Christian discipleship. So if you look at things like pornography, cheating, sexual promiscuity, all those things, the average student gets worse over 4 years. So in other words, they're more likely to be addicted to pornography. They're more likely to be promiscuous. They're more likely to be addicted to who knows what in terms of drugs after that. It's a huge shame. And in fact, we kind of joke about it and expect that that's the case. We have a college that's about Christian discipleship, where over those 4 years, we want our students to be strengthened over those 4 years. And so every week, it's called Journey Groups. We meet with mentors, meet with same gender groups of students, and we go over all of what's going on in a student's life that pertains to their spiritual development to make sure that doesn't happen. And finally, cost. We're about 80% less tuition than the average private school, which, especially in today's world, now that COVID-19 has hit, we're seeing that the whole world of higher ed is kind of vulnerable because they don't have the same ability to function given their hugely bloated P&Ls, their profits and loss statements that are out there. And again, this speaks to the fact that the modern university is this crazy out of hand combination of athletics with hospitality, with mental health services, and education's a tiny little portion of that. So we've tried to restore that to, as I said, a much more focused institution around education, particularly for people who are committed Christians.
So you're in Boston with a Christian college, and you have only two genders on your campus. How does that go over?
We only have two. Yeah, no. Admittedly, we're unique in a place like Boston and Massachusetts, but we love it, right? We want to be lights. We want to be uh, able to shine out in places that aren't used to communities like ours, and we feel like there's never been a better time for us to be outspoken in our faith, including with biblical concepts of sexuality, marriage, etc. So yeah, right on. We're very glad to be bucking some of the norms that are out there.
Good for you. I'm glad you're doing it. I wasn't aware of it, and I think every Christian parent ought to put Sattler College on their radar because you know, all four of my kids have gone to public schools. I went to a private college, Christian college, or Roberts University, and I've seen some of the difficulties, just the things that you face in going through them. Even conservative schools, and you know, I have a daughter graduated from Baylor, wonderful school. I have a son about to graduate from A&M, again, I think a great school. Still some challenges. My other two went to a little more liberal schools, and there's something to be said about a Christian education when it comes to higher education, especially. So I applaud you for the efforts you're doing with Sattler College, and we encourage people to check out sattlercollege.org. I want to touch I've got a few more minutes. Back to your article on, by the way, this is Dr. Finny Kuruvilla, those of you jumping in late. A long list of accomplishments and degrees, but I want to focus real quick on this article that he just published on the COVID and sort of our responsibility to it. And one of the things you address is the supply chain, the root causes. I think this is actually a very, very big deal. What do you think we should learn from this and sort of the way we've gone about things in our country and in the West in general?
Yeah, I'm so glad you asked this, Randy. This is one of my favorite things to speak about, and it's a bigger issue than even just this current COVID-19. So, according to the CDC, 75% of the illnesses, the new illnesses that are coming into human circulation now, come from animals. So whether it's mad cow disease or influenza, which comes from chickens and pigs, or coronavirus, which came from probably a bat, salmonella, E. coli, you name it. These all come from animals. And there's a great verse in the Bible that says, it's Proverbs chapter 12, verse 10, that says, "The righteous person cares for the life of his animal, but the mercy of the wicked is cruel." And one of the things that's happened in the last 100 years or so is we've really fallen too much under the sway of big ag, these factory farms and facilities like this that just cram lots of chickens or pigs or cows or whatever they happen to be in very small conditions. And these are just disease factories. These are petri dishes. And regular influenza, which now most people know kills around 300 to 500,000 people per year, right? Which is a lot of people. That comes from, as I said, chickens and pigs. The 1918 pandemic, the Spanish flu, that most likely came from Kansas. The H1N1 probably came from pigs in North Carolina. I mean, these are problems that are born out of our insatiable desire for cheap meat. Bible doesn't prohibit eating meat, but it does say that we ought to have compassion on animals and not cram them into really small conditions. And unfortunately, in America, we've gotten accustomed to, we want everything as cheap as possible no matter what. And we need to be thinking about supply chains, and is this right? Is this biblical for us to go down? And I think we're going to keep seeing more of these diseases unless we right that course. And so this is a great area for the Christian community to stand up for the mom and pop farmers who want to do right with old-fashioned farms and their animals, and cost more, but this is the right way for us to live. Otherwise, we're going to incur health problems.
Okay, I'm going to point out something, and it goes back to your initial statement, which is that Christians ought to approach all this and all of life with humility. Because when you start talking about the conditions of animals on food farms, you get into an area that is primarily dominated by people that are on the left or liberal. And most evangelical Christians are conservative. this is going to require us to set our political paradigms a little bit aside and say, you know what, I'm going to address something from a biblical standpoint, not a political standpoint. And it's going to be difficult for some people. Do you follow what I'm talking about? Do you see this at all?
Oh, I see it very clearly, and you're spot on. But yeah, you're right. This is not a left versus right issue. This is a biblical issue, and it's a sad day when we can't honor biblical teachings like that Proverbs 12:10 verse because of a fear of it being perceived as a political issue. This is something that is deeply biblical and is a great way for us to exercise our faith to help save lives.
It is, and I've seen this in the state of Texas when Governor Perry addressed prison reform, because he did a lot of wonderful things, and prison reform was sort of a left kind of issue, but he's very conservative and a Christian, and he went after it and made some really positive changes. Now, he didn't get the credit for it in the press because they don't like it when, because of their political biases, frankly.
Right.
But I think you're on to something that we really need to have the humility to say, okay, Lord, what's our position? I notice you didn't revert to an Old Testament stance that we shouldn't be eating pork.
No.
So you don't have a problem with meat or...
No, it's not about, I'm not saying it's meat or pigs or something like that. I'm saying it's the conditions, and it's this notion of cramming animals into small spaces for cost reasons. And it's not about kosher. Like, that's clearly all passed away. That's not right to and bring that on here. But to your point, there's a number of biblical figures that are Christian figures, Francis of Assisi, Tolstoy, Dostoevsky, that have spoken about this issue. Now, of course, all those people are deceased. This ought to be an issue that Christians are known for, and that we can actually purchase some social capital and win over some people from other camps. Because right now, if you were to go around and ask people, who's most likely to have compassion on animals, is it going to be a Christian, a Buddhist, an atheist, or a Hindu? I think most people would put the Christian dead last in that list of four, and they'd probably put the Hindu or the Buddhist up front. That's kind of sad, right? We should be known for treating animals well. And as I said, I'm not opposed to meat. I'm not saying that at all. But I'm saying there is something about compassion here and doing right by what the Bible teaches us.
Yeah, I agree with you. Here in Texas, we say you can tell the mettle of a man by the way he treats his horse. So
I like it.
Again, this has been Dr. Finny Kuruvilla. What's the best place for people to, if they want to read some of the things you've written? Is it at Sattler College, or do you have another website that people
Yeah,
can
Sattler
check?
College is a great place.
Okay.
I've got a lot on YouTube as well, but I would start certainly at Sattler College, and then YouTube would be number two.
Excellent. And I will show this one more time so people can see it. Sattler College up there on the left. And so the website is sattlercollege.org. So I'm reading a couple of... okay. So with someone who is watching right now has a farm, a family farm, and no, they buy their stuff from a family farm in Wyoming, and their beef from it, and that makes all the difference in the world. So, yeah,
Good for them.
Okay, yeah,
That's
good
the
for
kind
them.
of thing we ought to be doing, is patronizing small family farms that treat their animals well. It costs more, but it's the right thing for the animal, and now, as we're seeing, for global health. This is very expensive, these diseases we now see, and so if we think about this holistically, it's actually cheaper to do that when you do the right thing.
Yeah, I agree with you. And I hadn't thought about all of the flu and diseases that come from chickens being in tightly confined areas. That's a great issue, so I appreciate you bringing that up today. All right, we are out of time, so thank you, Dr. Kuruvilla, for being with us. And I encourage people to go to sattlercollege.org and read the articles you've written, and go on YouTube and check out the things you're saying. And to the rest of you, this has been an interesting one, has it not? So hit the share button wherever you're watching. Let's see, that's not it. That was yesterday. YouTube, Facebook, Twitter, Twitch, Periscope. Hit share and get the word out there. And we'll see you again tomorrow. I appreciate you all being with me here on Life Today Live. More really, really great guests this week. So don't miss an episode. And if you miss it in the live, watch it on the replay. We'll see you next time.